Hi, I'm Kate Pan, Psychological Services Consultant at the Waterloo Region District School Board. In this video, you'll learn a little bit about what anxiety is, who gets anxiety, and the different parts to anxiety. Anxiety is another word for worries, being shy, distressed, apprehensive, nervous, and being scared. It has a lot of different names. What these names have in common is that they describe how you feel when you're expecting that something bad is going to happen. Anxiety is future-oriented, unlike fear, which is an immediate alarm reaction to danger or life-threatening emergencies in the present moment. It's helpful to remember that anxiety is a normal emotion and that it's not always bad to feel anxious. We need to feel anxious sometimes to help us survive, keep safe, and perform better. For example, you may be anxious about a work deadline or an upcoming presentation. In these examples, it would be normal and helpful to experience some anxiety. But when this type of normal anxiety becomes severe and begins to interfere with your ability to complete your work or prepare for your presentation, it becomes a problem. If anxiety is preventing you from doing what you want to do in your life, then it is no longer helpful and you may be dealing with an anxiety disorder. There are three main components to anxiety: physical, cognitive, and behavioral. The physical part of anxiety consists of a variety of bodily symptoms, including elevated heart rate, more rapid breathing, and tense muscles, as well as an increase in your mental awareness. These changes prepare the body for action. The cognitive component. The cognitive aspect of anxiety consists of your thoughts when you are feeling anxious, that is, thinking that something bad will happen. This usually goes along with forgetting that there are other possible outcomes, some of which might even be positive. Often, anxiety produces intrusive negative thoughts that distract us from enjoying ourselves or being productive. The behavioral component. The behavioral part of anxiety is how you react in response to feeling anxious. Usually, people respond to anxiety in one of two ways. One, by attempting to reduce it with some sort of action, such as engaging in checking behavior or seeking reassurance. Or two, they may avoid or stay away from the sources of their anxiety. For example, they may procrastinate in the face of a stressful task or avoid direct contact with someone they're having conflict with. So, what are the main causes of anxiety problems or anxiety disorders? While we don't know what exactly causes anxiety, researchers suggest that genetics and learning seem to play a role. In terms of genetics, there probably isn't a specific anxiety gene. However, emotional sensitivity does seem to be genetically based, and people who are more emotionally sensitive may be more prone to developing anxiety issues. In terms of learning, researchers suggest that anxious people have somehow learned to expect that the world is a dangerous place. They may have learned it from observing their parents, relatives, other adults, or peers. They may have also learned it from unpleasant experiences or even traumatic ones. I hope you found this video to be helpful. Stay safe, and I look forward to being back with you all soon.